Well, good morning and welcome everyone. I really want to thank you for joining us for today's webinar about the just released California County Scorecard. I'm Ted Lempert, President of Children Now, and as most of you know, we're a statewide research, policy, communications, network building and advocacy organization that's focused on improving the lives of all kids with a heavy focus on kids of color and kids in poverty. And we're working with many of you on the phone to build an unprecedented base of power so that kids finally have the power behind them to be the top priority in policymaking, both in Sacramento and in local governments throughout the state. And part of getting to that is providing organizations and leaders across the state with tools that can help them be better advocates on behalf of kids. So the California County Scorecard for Children's Well-Being that we'll be going through today is a snapshot that helps you see where kids' health, education, and child welfare is improving and where too many kids are slipping through the cracks. It gives data on how our kids are doing in each of our 58 counties, broken out by race and ethnicity. Children Now's experts in health, education, and child welfare policy help build the scorecard so that we can provide information to our range of diverse local partners who are on the ground, doing their best to make sure community resources are wisely invested on behalf of kids. So many of you on the webinar are those partners. We've got parents groups, community groups, civil rights groups, business, labor groups, government folks, a range of diverse partners on the phone today. And many of you are part of the children's movement, which is now over almost 30,000, we'll get there, 3,000 organizations strong throughout the state. And we really welcome your questions and feedback so that we can make sure that the data is really used well on behalf of children throughout the state. So it's my pleasure to turn it over to Kelly Hardy, our Senior Managing Director of Health and Research. Kelly is one of our superstars here. She's been with Children Now for 12 years, and when I asked her to jump in to lead our research work, I don't think she realized just how much she would love spreadsheets. And if you're ever in Oakland and you want to come by her office, you can see her in action. So Kelly, thanks for your great work, and take it away.
Great. Thank you, Ted. And good morning, all. Thanks so much for joining us to talk about data and kids, two really great topics. The new California County Scorecard came out last week, and folks are starting to dive into it, and I'm really excited to show it to you today. As Ted mentioned, Children Now has been around for 30 years, and I've been with Children Now for 12 of those years. And I'm really excited to present the new features of the scorecard this year. So here's what I would like to cover with you today. I'll tell you about what the scorecard is and how others have used the tool. We'll get into more details about the data that's available, discuss the trends that we're seeing in the data now, and then walk you through how to find and use the data that's significant to you and the counties that you represent and the communities of interest to you. And then I'm really eager to hear your questions. So please type questions into the Q&A area of the webinar on the right, and I'll answer as many as I can at the end. And if we don't get to everybody, I'll follow up with folks, but we will leave plenty of time for Q&A. For those of you who don't know about the scorecard, it's an easy way to access data about California's kids, and this year it's in a new mapping format. Children Now has produced the scorecard since 2007, and the purpose is to track indicators, as Ted said, of education, health, early childhood, and child welfare across the 58 counties. We want to help communities identify where there's room for improvement, encourage the discovery of best practices, and also foster collaboration between communities. If you see a neighboring county that is doing really well on something that perhaps your county is not, maybe you can get some ideas. We're also all about supporting community action on behalf of kids, so giving you all the tools that you need to advocate for kids in your communities. The scorecard's an evolving tool, and we always appreciate input about how it can be more useful for you. This year, the scorecard has 30 measures, and we added 10 new different measures this year. We choose indicators based on the following three criteria. Is there data available for all or nearly all of the 58 counties so that we can make apples-to-apples comparisons? can we break the data out by race and ethnicity where possible? And third, does it fit on a 100% scale? So what I mean by that is we want to be able to say 100% of our kids should graduate from high school, or 100% should not be low birth weight. Sometimes that leads to a little bit strange wording of the indicator itself, but then all of the data is going in the same direction. So 0% is bad and 100% is good, and we want to get all our kids to 100%. There's many issues and measures that we wanted to include in the scorecard that didn't meet those criteria. And you'll probably think of a few as I go through the presentation. I'm happy to take ideas, and if we explore data that was available in maybe 35 counties but didn't fit in the scorecard, maybe your favorite county is on that list, and we'd be happy to share that information. The scorecard reports out on data from multiple primary sources, and I'll do my best to answer any specific questions about methodology. But you'll also see once we get into the scorecard tool itself that there's a prominent sources button on each page so that you can really get deep into the primary source if you're interested in following up and access those details. All right, let's get into the data. Remember, these numbers reflect the most recent available data, which in most cases is 2016 or 2017. In some cases, it's 2018 data. Overall, there's 9.26 million children in California, and 46% have one or more immigrant parents. A similar number, 47%, are in families making less than 2 times the poverty level, which is about $50,000 a year for a family of 4, regardless of where you live in the state, a high-cost area, a lower-cost area. So that, of course, does not stretch very far. 52% of California's kids identify as Latinx, 27% white, 11% Asian, 5% Black, and 5% other races. That includes multiple races and didn't want to state. And there's over 204,000 students experiencing homelessness across the state. So hopefully you had a good breakfast this morning. I've got a little pop quiz. And bear with us as we're figuring out how to make the survey mechanisms work here. Okay, and the first question is, what percentage of California's 12th graders graduated high school on time in 2017? Give you a moment to choose what you think it is. All right, let's go ahead and close the poll. And it looks like most folks thought it was 76%. A significant number of people chose 83%, which is the answer. 83% graduated on time in 2017. On to the next question. There's only 4 questions, so don't worry, I'm not going to tax you too much. The next question is, what percentage were measured to be college or career ready upon graduation? Now, while folks are voting, I could just say a little bit more about this measure. This means that the graduate has at least a high school diploma plus any one other piece of the following. So there's a career technical education pathway, there's passing score on 2 advanced placement exams or international baccalaureate exams, or completing the courses that meet UC or CSU criteria for entrance, and a few other measures. But basically, they have a high school diploma plus they've shown in some way that they're ready for college or a career. So we can close the poll here. And it looks like we're fairly evenly split. The correct answer here is 41% were college or career ready. So that's about half of those who graduated on time, and makes you question really what a high school diploma means if the student isn't ready for the next level. So let's move along to the next question here. And that is, what percentage of eligible students ate free and reduced price meals during the school year? And while folks are voting, this is students who are already eligible due to income, being low income. Just give you another moment or two. Okay, let's go ahead and close the poll. So I see we have some optimists this morning. I like it, but most folks said 64%. The actual answer is 54% of eligible students ate those free and reduced price meals. So we could be doing much better in getting nutrition to the kids who need it. Let's move along to the very last question, which relates to this previous question. What percent of eligible students were eating meals during the summer months? So this is the same denominator as the previous question. Students who are eligible because they're low income. And during the summer months, they can access meals at libraries, school sites, and other places throughout the community. So what percentage do you think are actually doing that? And we can close the poll. And the actual answer is 8%, which it looks like barely most people chose. 8%. We're only reaching 8% of those eligible kids during the summer months. So where are they getting nutritious food from? Hopefully they're getting it at home, but even if they are, their family is missing out on important financial supports. So we really need to be doing better again in getting those critical nutrition and financial supports to families and students who need them. Children Now is working with partners to ensure that students have access to food at school so they can focus on learning. For example, through community eligibility for schools with high free and reduced price meal participation. We also know that obesity and food insecurity go hand in hand. They're sort of flip sides of the same coin, so we need to tackle those issues together. Let's move along to some other things that we see in the data. Some of the biggest challenges are around childcare, oral health, and some of the academics, math and reading actually, in school. So we see that early lack of support around affordable childcare or young children visiting the dentist often translates into wider disparities and poorer outcomes as children become young adults, for example, in college math, or the numbers that we saw around voting registration for young adults. This data emphasizes that the state needs to radically step up our support for young kids. Children Now is advocating for significant investments and systems improvements to ensure that families have access to quality childcare and other early childhood programs. Around dental, the data shows that the state has to step up the emphasis on oral health care. There's been some helpful efforts recently, but that work is not showing in the data yet. And again, we're working closely with state and county partners to implement a state oral health plan, which puts emphasis on increasing dental utilization rates among young children. Some other challenges that we see are around nutrition, as we discussed, and care of children in the child welfare system. The data emphasizes several key needs for children in the child welfare system. Permanency, that they're changing placements far too often, and only 27% were in the same placement for 24 months. Family-like settings, meaning that children need to be in a home, not in an institution. and coordination of care, in that only 75% of foster youth received timely medical exams and 62% had timely dental exams. These are California's kids, and we need to be taking better care of them. Some of the things that we've advocated include making sure that foster families and potential foster families have the supports and services that they need, including childcare and a 24/7 trauma-informed hotline to help them through urgent situations. We also see that most of the indicators, most of the 30, have significant racial or geographic or both disparities, and that the place and socioeconomic circumstances of a child's birth determine far too much about her well-being later in life. I'll touch on some of the most striking issues here, but I likely won't say enough about the why and the how of those disparities, so I'm counting on you to really help tell the whole story. Also, these broad racial categories often mask internal inconsistencies. For example, the Asian category also includes Cambodian and Laotian and Hmong students who tend to have higher high school dropout rates than African Americans and Latinos. So the Asian model minority myth really needs to be picked apart when you look closer at the data. Children Now works with our partners to first ensure that we have information about these disparities, and also that we can understand how to better support our most vulnerable kids, Black and brown kids, those from the rural north, immigrant children, children with disabilities, English learners, and many others. What we see here is that third graders' reading proficiency is low, and that there's a large disparity among races and also among counties, with 76% the high for Placer County and 33% in Alpine County. Additionally, we see that for readiness for math, we see even worse numbers, at 32% overall, which masks a large disparity between 48% for Asian down to 15% for Black students. And again, a large county disparity, 52% for San Francisco and the low for Lake County. Just one more example of these disparities that I'll point out here, that pregnant women receiving prenatal care in the first trimester, we have an 84% score overall, which is, relatively good on the 100% scale, of course. But this is a life and death matter both for the mother and the child. And so we really need to be at 100% here. We're seeing 88% for white women and 79% for Black. And counties range from 91% in San Mateo to 50% average in Modoc County. So again, we see that some of the counties in the rural north really need better supports and access to care. We know that access to timely care in rural counties can be a real problem. And we also know that the C-section rate amongst Black mothers at 42% is by far the highest among any racial or ethnic group. And I know that there's been a lot of work done around that issue, but it's still a troubling disparity that we see reflected in this data. Moving along, there's a lot of depressing data, but we also see some bright spots. These reflect areas where the state has made a concerted effort to invest in statewide policy and follow that up with strong implementation in the communities. There's some definite good news on the health side of the ledger around immunizations and health insurance. And again, these are places where there's been decades-long efforts to raise those numbers. Interestingly, some of the measures where we see the higher average numbers are the same ones where there's fairly large racial or geographic disparities. So we need to make sure we're lifting all boats here. some other bright spots. We do see some good news on school climate measures. For example, suspensions and expulsions not due to defiance or disruption. There was a 76% statewide average in 2016, and it improved to 80% in 2017. And we saw similar gains across all races. So that's really good news. Children Now is working to eliminate this defiance and disruption, suspension, and expulsion in all grades at school, which disproportionately impacts children of color. We also see that students who are not chronically absent from school, there's an 89% average, which is fairly high. That's only 1 year of data that's been collected, but it's a good start. There's plenty of work to do in that area. And we're really working with partners to make sure that students have the support they need to attend and succeed in school. This can be an early warning sign, chronic absence can, for problems much later in life. Now I get to show you the scorecard tool, and I'm just so excited about, as I said, our new mapping feature here. So I click on either our homepage or just going straight to the reports and research area. And then I'm scrolling down a bit to click on use the tool. All right, so just to orient you to the page, this shows that at the top we've got the indicators and the place area, the drop-down menu, and then also races. So I'll start by, for example, I got a question the other day. Someone from San Diego wanted to know how many kids were overweight or obese. So I can go and choose an indicator, either looking at the list of all or from one of these 4 categories. So I can look at the health category and then go on down to 7th graders who were not overweight or obese. Clicking there, I can see there's a 61% average in 2017 across the whole state. And the California average is shown by this line here. And you can see the top county ranked here and the bottom. And if you'd like to see all counties, you can expand it and look all the way down. And then go back to the overview of counties. This also has the state breakdown by race over in the bottom left corner. So you can see how different groups of kids are doing. And then we can look at all the counties over here in the map. And they're color-coded depending on where they fall on the percentage here. So I can choose San Diego either by choosing from the drop-down menu up here, or by clicking on the map. San Diego. All right, and then it shows me where San Diego falls, again, overall in the counties, and the specifics for San Diego's breakdown by race. You can view the sources and notes for that specific indicator. Hide the sources and notes. You can look at a specific race for that county. And then you can also compare where it's available. We have a previous year of data. So you can compare to 2016. Here's 2016, here's 2017. And then this is important, and I know that a lot of folks have really been looking for a printable version of the data that they can, for example, take to their county board of supervisors and talk with them about children's issues. If you look at the right-hand top side of the page, it says download PDF here. And that will download a printable 2-page PDF where you can look at all of the indicators and see where we've got data for San Diego County. And again, here's the demographic information on the right for the children in San Diego County. Okay, great. Did I cover everything for that part? Yes. Okay, great. So that's the tool, and I'd love to have folks play around and see, you know, what's most interesting to them, where there's regional disparities, where you're seeing sort of hot spots on the map, and we're just really excited to have this out there. All right. So how do we use this data to improve the lives of kids? Ted mentioned the children's movement, and we want all of these indicators, all 30 of them, to be at 100%, but obviously they're not there yet. And California's kids deserve better. Now, I know there's many things that you're doing in your communities to help kids. And statewide, the children's movement is bringing together local child-serving groups to influence state policy and to amplify your voices at the state level on behalf of kids. If you check out childrennow.org/the-movement, you can see the other organizations and businesses in your area who are part of the movement, and you can sign up to get updates about ways you can take action to influence state policy. Our current campaign, just for an example, is around protecting immigrants from a proposed federal policy change on public charge rules that would really damage immigrant kids and families' access to services and supports that they need. And now I'd love to move along and take any questions you might have about the tool or the data. We'll just pause for a moment to let questions come in. Great. Okay, so logistics, you will get a copy of the presentation. Both folks who signed up for this webinar and are on the phone right now, and people who didn't. So those copies and recordings are coming. Okay, there's a question about the C-section rate for, it says the C-section rate has gone up for all women. Why do you think Black women have a higher rate of C-section compared to other women? There's a really great report that just came out, Listening to Mothers, from the California Healthcare Foundation, and that shows 42% of Black women with C-sections. I'm not remembering the exact rates for other racial groups, but it was a good 10 to 15% higher from the next racial group. So that I want to say was about 30%. So there's good data backing this up, and Black women's C-section rates are across really all socioeconomic statuses. So it's a problem that needs addressing for the women and the kids. Okay. There's a question about other subpopulations like foster youth. That's a really great question. There's specific, when you look at the child welfare indicators, that's where we included all the data that we had around children in the child welfare system, which includes foster youth and some others. And that data, as you'll see from the notes and sources, comes from a really wonderful resource from the University of California at Berkeley. When we're looking at the rest of the population, to break out foster youth is too small of a number to get reliable data. So we're not able to do that when we're looking at the rest of the population. And unfortunately, for most counties, it's the same story for breaking out the other racial category. The numbers get too small and we don't have reliable data. So we erred on the side of publishing numbers that we knew from the primary sources had reliable data behind them, and making sure that we weren't putting out there anything that did not have a big enough sample size. Okay. There's another question. Have you observed any particular trends with respect to high quality early education? And my friend Ted Lempert might want to answer this one.
Well, we are seeing a lot of local communities step up. Certainly through First Fives have done incredible investments, both in terms of quality childcare and preschool. That said, I think what the scorecard tools show is how, even in the counties that have invested the most, there's still significant gaps. And it's no surprise that, we're looking at the state government playing a much more leadership role in the coming couple of years on that as well. But, a real shout out to First Fives throughout the state who have really done some quality investments in the various counties, which have helped make these stats better, certainly than they otherwise would have been.
Thanks, Ted. Great. So some other really good questions about, is the data available for smaller subpopulations within the county or available by zip code? We're working with a few counties on other projects where we can break out subgroups within the county, because we recognize that a county average can really mask a lot of disparity. Within Contra Costa County, kids in Richmond are not living with the same kinds of opportunities as kids in Walnut Creek generally. So for these indicators, for this scorecard, that level of data is not available, but if you're interested in sort of digging deeper into the county data, we do have a couple of projects going with counties who've shown particular interest. There's another question about subcategories for data specifically for birth to 5. Again, that's a super important population. In many cases, we can't break out that data because the sample size becomes too small. But we do have fresh off the presses as of last night, we have a separate PDF showing California's children 0 to 5 and the data that we have that's available for them. So I would think that will also be up on our website at some point. Yes, that will be up on our website. And we recognize that 0 to 5 is such a critical time for investment in kids, and it really gives you such a bang for the buck. Okay, great. So there's a few questions about printing out a PDF of several counties at once, and that is coming. It's available, and it's going to be up on our website shortly, the overview of all counties. So right now we have the California overview that you can print out, and then specific counties. It's a little bit labor intensive at this point to print out for each specific county. But I think it's 112 pages of the whole list of 58 counties, plus the notes and sources, plus California, is going to be posted on our website soon. Okay, I'm just going to look for the next question. For someone asked, do you track teen pregnancy rates? That's not something that we have here, mostly because of the limitation around wanting all our indicators to be on that 0 to 100% rubric and not having enough sample size thankfully, on teen pregnancy. But I can follow up with, I know that the Department of Public Health and the Department of Healthcare Services do a good job tracking teen pregnancy rates in California. Just looking for the next question. There's lots of questions, and we will get to all of them either now or following up later, but I'm just trying to figure out which ones might pertain to many people. There was another question about data on LGBTQ students or LGBTQ youth. Do we have any information or subpopulation data? And we don't at this time. I'm sorry to say we are trying to do more about that data. I can point you to the LGBT HHS network, which is a sub project of Health Access, and they do have some good data, as I'm sure others across the state do. And we're working on a separate infographic about LGBTQ youth, but again, we're in a spot where we are not seeing enough sample size to let us make these apples-to-apples comparisons across all counties. And the source of the data for the 0 to 5 children, the question is, what is the source for the data for children 0 to 5 read to by an adult? I'm a little confused when I look at the source box. And that, that data is from, the California Health Information Survey. I think we made a special request for that breakout. The 0 to 5 read to every day.
Oh, that's from the California Check Survey.
Okay.
Every day.
Yeah. So I can also follow up with more information on that, but it's from the CHIF. Thank you. There's another question about collecting information about children's parents' immigration status, and that's not something that lends itself to the scorecard tool. So I'm not sure where that data is, but we could follow up on that. And then another question that I see about, is children now tracking the federal SNAP budget bills? This is something where we're providing support. We work a lot with friendly partners in DC, but we're not sort of intimately involved in the federal nutrition issues. Okay. I think I have one last question I wanted to address. What is the stat of kids who qualify for free and reduced rate meals? And that's one where I'd need to follow up and send you that data specifically. But those numbers are quite high, as you can imagine. And I can see if we could get something like that for all counties. Again, that's a situation where we wouldn't want all kids to qualify in the county. We wouldn't want that stat to be at 100%, and so that's not something that we included in the scorecard. But we certainly want all eligible students to be accessing those meals, and so That's why that stat is in there the way it is, but we can follow up with additional data for that person who asked that question. Okay. Great. Well, I want to thank all of you for spending some time with me on the webinar talking about kids and data this morning. And I will certainly follow up with answers in much more detail to those of you who asked questions. If you do have additional questions or want to reach out or have suggestions, any other input about the scorecard, if you could email research@childrennow.org, that would be really helpful. That way we can track all of the incoming thoughts and questions and make sure that we follow up with all of you. Thanks so very much. Bye-bye.